The Washington National Cathedral tolled its bells 900 times to honor the more than 900,000 lives lost due to COVID-19. Members of Congress also held a moment of silence on the steps of the Capitol building. According to the CDC, the U.S. is expected to hit 1 million deaths later this year. In the last week or so, we've seen quite a dip in the number of COVID cases here in Indiana. That's good news. Over the weekend, just over 2,000 new cases were reported, and this is really good news, 0 new deaths. And on average, we're back to numbers similar that we were seeing in mid-December before Omicron really took off. As far as hospitalizations go, about 20% of all ICU beds are available across the state, with about 24% in use by COVID patients. Just over 75% of all ventilators are available.
And cases of Omicron are starting to drop off across Indiana, and so are the number of Hoosiers heading to COVID clinics, whether it's for the vaccine or just to get tested. Next Friday, the vaccine clinic at the 4-H Fairgrounds in Hamilton County will be shutting its doors again. At its peak, though, the clinic served about 400 people a day. Recently, it's been seeing less than 100. And it's not just vaccines. Many counties are also seeing a decline in testing. For months, Fisher's Health Department was slammed with appointments, but now they say it's easy to find a time slot.
It was frustrating when we couldn't offer that every day, but we're glad that we're back in a position where that's not such a critical need right now.
And this drop in demand comes as cases fall across the state. Another driver in this decline is the widespread availability of at-home test kits. But many times those results go unreported, and that can be problematic for tracking and virus and emerging variants.